Good evening, everyone. Are all the participants here in the meeting?
Uh,
Team A, have both of you joined?
Yes, we have joined.
Okay. Team B,
Yes, both have joined.
okay. Team B both have joined.
Yeah.
Team C,
just a minute, my partner is joining.
okay. Team D,
Team D has joined.
Team E,
One of
Okay, so welcome everybody to Panacea 2.0. So first of all, congratulations to all of you for qualifying for the finals. Among almost 530 participants, this is the top 6 we have. So today is the finals. We wish everyone all the very best, and we hope you all have a very happy quizzing today. So this is our team, Panacea 2.0 for this year. We are the ones who made the questions, and with all the PR work and everything. Special thanks to Students Association AIIMS Bhubaneswar for their help with the technical stuff and PR. So here we go with the first round of today. That's called amalgam. So here are the rules for the round. 4 images will be displayed to a team and 1.5 minutes will be given. The first team has to answer by the end of 1.5 minutes. After 1.5 minutes, if the team is unable to answer or has partially answered the question will be passed to the next team, and so on. Points for the direct answer will be 30 points. That is 10 points for the final answer, that is the relation, what that images are relating to, and 5 points for description of each picture. Please note, you can't start describing the images without telling the final answer or the diagnosis. First, you have to tell the diagnosis or the final answer, and then start describing the images. And then points for the past question will be 25 points maximum. That is 5 points for the final answer and 5 points for description of each picture. 10 seconds will be given for past question. If partially answered, the points will be decided by the discretion of the quiz master. Is there any doubt regarding the rules of the round? Just remember that first you have to tell the final answer and then start explaining the images within the 1.5 minute time frame that's being given to you. Clear, right? Anybody has any doubt? Any participant, any team member? Okay. So here we go. Over to Sohan.
So welcome everyone again, and I am Sohan, and I am going to conduct the first round of Panacea 2.0. So as the rules have been stated by Subiksha, that we'll proceed to the question of Team A. So Team A, your 1.5 minutes starts now. So 1 minute is remaining.
If his final answer is PCP,
At the end of-
leading. What? Hello.
Hello. At the end of 1.5 minutes, you can say the answer. Okay.
Acha. Okay.
So 30 seconds are remaining.
Can we start?
Okay.
Hello.
Tell the answer. Yeah, hello.
Final answer is phencyclidine.
It's wrong. So the question is passed to the next team. So Team B, you get 10 seconds for the question.
No negative, right?
No negative. 10 seconds are over. So
New
Team
move
B,
media stream.
no, it's wrong answer. So the question is passed to Team C. You also get 10 seconds.
Hanging. Death by hanging.
First tell the diagnosis, please. Then only. Time up.
Pass.
Okay, Team D.
Is it our chance, Team D?
Team D, 10 seconds are up. Tell the answer.
Okay. Neoperitoneum?
Mediastinum.
Pneumomediastinum.
No, it's the wrong answer. The question is passed to Team E. Ten seconds are up, Team E. So, do you have the answer?
Pass.
Pass. Team F.
Coxsackie virus?
No, it's the wrong answer. So, the question is over, and the correct answer is diphtheria. The first image is gram-positive rods. Second image is a bull, which indicates the bull's neck, which is present, which is a manifestation of diphtheria due to the edema of the neck and tonsillitis. The third image is it shows the strangling angel disease of the children, other name of diphtheria. And the fourth image explains the Chinese letter pattern which is seen in diphtheria, in gram stain as well as the Albert stain. So first question is over. Now we'll move to the next question, which is for Team B. This is the answer. Team B, your 1.5 minutes starts now. One minute remains for you.
बोल दूं?
Yeah, you can speak.
Yeah, the overall answer is Takotsubo cardiomyopathy. The first
The answer
picture,
yeah.
the first picture shows the vessel which is used by Japanese people to capture octopuses, and the shape of the heart is similar to that. That's why it's known as Takotsubo cardiomyopathy. The second image shows a broken heart. It is also known as broken heart syndrome, and it is characteristically seen after a period of emotional stress, such as after an argument or a fight or a breakup. And the fourth image shows adrenaline, and it is adrenaline is involved in the pathogenesis of Takotsubo cardiomyopathy.
Okay. You get 30 points for this question, Team B, total. So then, good job. And then we move to the third question, which is for Team C. So your 1.5 minutes starts now, Team C. So 1 minute is up. 1 minute is remains. Thirty seconds remain. Ten seconds remain.
Overall answer is Behçet's disease.
Sorry, it's the wrong answer. So the question is passed to Team D. Team D, you have 10 seconds.
Is this a case of syphilis?
It's the wrong answer. So the question is passed to Team E.
Yes, the final connect is mercury poisoning.
Okay, the diagnosis is correct. So please explain the images.
First image is the fish that
Which is the cause for the Minamoto disease, which was seen in Japan. The people got mercury poisoning as a result of contaminated
the
fish.
fish. Second is a glass blower. It is also known as glass blower's disease. Then the Amitabh Bachchan film Pink's disease also, and
Okay.
that aphthous ulcers are seen as a common feature in that.
Okay. Your total answer is correct. So team E gets 25 points. And which team was going? Okay. So we'll move to the next question, which is for team D. Team D, your 1.5 minutes starts now. So one hint I can provide you that it is related to a drug. That's all. One minute remains. Thirty seconds remain. Ten seconds remain.
Is this ketamine? Ketamine poisoning.
Diagnosis is correct. So please explain the images.
Basically, in the B image, that the woman, like, that's the dissociative anesthesia part, and like in this we can see a tachycardia and like an arrhythmia, and like in pressure cooker it says that it will increase the BP of the patient because it's an ICP.
The first image.
Ketamine increases all withdrawal reaction.
The first image. What did you say?
War something.
Like it's useful in a patient like
in war, in war.
Hypovolemic shock.
Okay. So team D, you got 30 points. Good job. And next we move to team E. So team E, your 1.5 minutes starts now. In the end, show me the score. I will announce. So 1 minute remains. Thirty seconds remain.
Hello, can we answer?
Yeah, you can answer.
Final connect is Pseudomonas.
Okay. It's correct. Then explain all the images.
First image shows green colored colonies. Second, Shanghai. It is also known as Shanghai fever. Third, it shows a swimmer. It causes swimmer's ear, that is otitis externa. And last image is silver. Last image we wouldn't like to. The steel plate, like.
First image, can you tell the agar which is shown?
Cetrimide.
Yeah, it's correct. But the fourth image explanation you could not give. So you got 25 points. So the fourth image explanation is passed to the next team, which is team F.
Pseudomonas is a very common cause of burns, and for burns treatment, silver sulfadiazine is used.
No, it's the wrong explanation. Then team A.
Is that for metallic sheen?
Yeah, it's correct. For metallic sheen, it's correct. So you team A gets 5 points, and team E gets 25 points. So now we move for the question for team F. And your 1.5 minutes starts now, team F. One minute remains. Thirty seconds remain. Ten seconds remain. So team F, your time's up. Please answer.
We'd like to guess HOC, cardiomyopathy caused by tafazin mutation.
HOCM.
No, it's the wrong answer. So the question is passed to team A. You have 10 seconds, team A.
Marfan syndrome.
So it's the wrong answer. Question passed to team B.
Is this homocystinuria?
Yes, the diagnosis is correct. So please explain the images now.
Excuse me. Hello.
Hello.
Hi, Abraham Lincoln had Marfan, not homocystinuria.
We'll explain in the end.
Yeah,
so
but
let team B answer, right?
Yeah, we also were thinking Marfans, but Abraham Lincoln had Marfans, but the clue was I think
Autosomal
Marfan
recessive,
habitus because the second clue says autosomal recessive.
Yes. Then third image.
Third shows classic attack of angina, which is seen in premature atherosclerosis due to homocystinuria, and the fourth is lens dislocation.
Okay. Lens dislocation. Yes, it's correct. So team B gets 25 points. So I think the doubt is clear about the difference between Marfan syndrome and homocystinuria.
Yes, I didn't see the recessive.
Okay, no problem. So now I'll announce the marks or the points which were allotted to each team. So at the end of the first round amalgam, team A has 5 points, team B has 55 points, team C has 0 points, team D has 30 points, team E has 50 points, and F has 0 points. So now I'm passing over to Subiksha.
Okay, now we move on with the second round, and that's called constant variables. Okay. One second. I'm really sorry, there was a small incoordination. The next round is concatenation, or it's basically a pounce round. Questions will be directed to all the teams, and the teams have to message the answers via Zoom to the coordinator assigned to your team. Even they have joined the Zoom meeting. So here, one instruction that is to be given to the team is that first we request all of you to send a hi to your particular coordinator. Change the settings in your Zoom chat to that particular coordinator, like volunteer team A or volunteer team B, and please send a hi to them.
Yeah.
Excuse me, we cannot see the option in the chat.
Yeah, there is no volunteer.
Yes.
There is no volunteer.
Like next to the chat to option, like there will be everyone, right? Click on the arrow near it and just change it to your volunteers.
But the arrow, it's the list.
There are options of Sapientia, Webinar, AIIMS Bhubaneswar, Adarsh Srivastav, and SAB.
And there's nothing else.
1 second, just give us some time.
Our volunteer is not in the meet.
Just a second. In the meantime, we can have a small introduction of all the participants. We just started it off. So team A, you can introduce yourself. Team A.
Yes, hello, I am Devesh Dharmarajan, final year student from SAIT GSMC.
Okay, your teammate.
Hello everyone, I am Aniket Bose, final year MBBS student from Mednapur Medical College, West Bengal.
Okay, well, team B.
Good evening, everyone. My name is Tilak, and I'm an intern from BJ Medical College, Ahmedabad.
The other participant from team B.
Hello, I'm Akash Sethi, and I'm also an intern from Government Medical College, Baroda.
Okay, and team C.
Hello everyone, this is Soumitra Dinodia. I'm an intern at SAIT GS Medical College and KM Hospital.
Okay, your teammate can also introduce.
I am Manav Shah, intern from SAIT GS Medical College and KM Hospital, Mumbai.
Okay, team D.
I'm Devang Agarwal, third year MBBS student from AIIMS Rishikesh.
Hello everyone, my name is Palak Dhaka. I'm an intern from AIIMS Rishikesh.
Okay, team E.
Hello everyone, my name is Deban Panacea, third minor MBBS student from SAIT GS Medical College, Mumbai.
My name is Amey Ambike, third minor MBBS student, SAIT GS Medical College and KM Hospital, Mumbai.
Okay, the last team.
Hello everyone, my name is Arushi Narwani and I'm an intern from BMMC and Safdarjung Hospital, Delhi.
And I'm Ajit from the same college, and I'm also an intern.
Okay. Just check your chat once now. I think the option has been enabled. Please send a hi to your respective. So we can proceed on with the round. So in this round of concatenation, that is a pounce round, questions will be directed to all the teams. 4 clues will be sequentially displayed for each question. The first clue will first be displayed and then a time of 1 minute will be given. The teams are requested to send the answer within the 1 minute to your respective volunteer on Zoom chat. After that, second clue will be sent and a time of 45 seconds will be given. Then third clue and a time of 30 seconds will be given. Fourth clue and a time of 30 seconds will be given further. Each team is allowed only one guess per question. If you have given one answer for the question after the first clue, you do not have a chance to answer again after the second, third, or the subsequent clue. So please make sure that you answer it rightly when you are sending the answer. In case you do not want to answer after the first clue, you can just send a pass to the coordinator on Zoom within the time frame for that clue. Okay, hope everybody is clear with the rules. Any doubts? There is no negative for this, but you only have one chance to answer the question.
I have one question. Hello.
Tell.
You are saying that if we are not willing to answer, like we have to send pass every time.
Yes, after the first clue, you have to send a pass.
Like
After that particular clue, you have to send a pass.
Okay.
And then please note that for the first clue, after our quiz master completes reading the question, the 1 minute time frame will start. Okay, so there's no hurry. Once the quiz master finishes reading that particular question, your 1 minute will start. Then you can start sending your answers to your respective volunteer on Zoom meeting. Is that clear to everybody?
I wanted to know the pause window is how long? Like what is the duration during which we can answer to the volunteer?
The thing is, it's not the question is not directed to one particular team. It's directed to everybody in general, and the pounce window is same for all the teams. That is 1 minute after the first clue, 45 seconds after the second clue, 30 seconds after the third and fourth clues.
Okay, thank you.
Okay. Is there any other doubt? And please note that first a question will be given, and that itself is the first clue. Subsequently, 3 clues will be given. Okay. All set, right? We are good to go? Okay. Over to Binay.
So welcome back again. Everyone is clear with the rules. We can start the first question. The first question is here. I'm reading the question. After that, you can start. A 55 years old female presented to the OPD with difficulty in swallowing and generalized weakness of body. On examination, there was glossitis, ileosis. Upon performing blood investigation, the hemoglobin level were 9 gram per deciliter. WBC count was 5,000 per millimeter cube, and platelet count was 2 lakh per millimeter cube. MCB was 50 femtoliter, and MCH was 23 picogram. RDW was 18. There was difficulty in passing endoscope through the gastrointestinal tract. What is your probable diagnosis? Your time starts now.
Just a minute. The answer is the same for all. Like this is the answer to this is the overall answer for this question.
Yes.
Yeah. I'm asking the answer to this is the overall answer to the question, right?
Yes.
Excuse me. We have sent the message. So will we get some confirmation from our volunteer, or do we have to just sit and wait?
Times of after all the clues will be sold, you will get the. I think you have got the confirmation for the first clue. Whoever has said the answer.
We
have not
got the confirmation.
Even we haven't.
Can
Team
you
F.
tell your team name?
Team F.
We got it now, team.
Okay.
We still haven't got it. Team F.
Just hold for a second.
Yeah.
We are checking. See if you're getting this now. Team F.
No, we haven't. The last.
Just hold for a second.
Yes.
But
Yes, we have got it. We have
Yes,
got it. We have got it.
Thank you.
everyone got it? I think everybody answered it correctly. So we are seeing the next clues. All the clues we'll see. So this is a Palmer-Wilson syndrome. So it's a triad of dysphagia and anemia under this esophageal waving. I think everyone has answered. No need of explanation, I guess, for this question. Everyone clear for this question? So I'm going for the next question.
All teams get 40.
Yes, yes.
Oh.
Okay, I'm going for the next question. Okay, I'm reading out the question. A 48-year-old right-handed man was admitted with a 3-day history of brief generalized tonic-clonic seizure, a 3-month history of weight loss with increasing difficulty in eating, and 1-week history of word-finding difficulties and speech apraxia with reduced fine motor skills. On examination, he had bilateral lower limb and significant right upper limb and orolabial dyspraxia. Most notable was his difficulty in conversing, displaying an expressive and receptive dysphagia. He had an ataxic gait and coordination was impaired in the upper and lower limbs. He also complains of muscle weakness. He had no fever and had stable vital signs. He had a diagnosis of type 2 diabetes mellitus, epilepsy, and a history of left temporal lobe infarct 3 years ago. What is your probable diagnosis? Your time starts now.
Recording in progress.
It's not visible and it is neither zooming
15
in, so
seconds
we're
remaining.
not able to see.
Zoom in a little, please.
We're not able to see the second clue.
Time's
We
up
are
for the
not able
second
to see
clue.
the second clue. Hello? Am I audible?
Yes. Yes, you
We are
are
not
audible.
able to see. Yeah. Volunteer is also
You're not
left. Second clue, and our volunteer is also left the chat.
Okay, we're seeing with that. You check your internet connection if it is proper or not.
Okay. Okay.
You can send the message that team group you are assigned now for in WhatsApp for the answer. You can say your queries there. I'm going for the next clue. Thirty seconds.
It says volunteer B is restricted from receiving direct messages. अरे एक मिनट Okay.
Send on WhatsApp. Whatever queries you're having, send in a WhatsApp. And your answers.
Our volunteer is not in this meeting. Whom should we send the answer?
They are there. They are seeing you, Meshes. Don't worry.
I see. I can send you a screenshot. I am sending it written. Volunteer is not in the meeting. How do I
We
send
are
the
also
answers?
not able to send the answer to our volunteer.
Message in WhatsApp your answer.
WhatsApp group है ना बना तो।
There's look at Mailas.
Okay, we are sending on WhatsApp.
सौमित्र अनम्यूट करके भाई म्यूट करो
क्या?
म्यूट तो करो
अरे मीटिंग ऑन थी क्या? शिट सर.
So I'm showing the last two.
Excuse me, volunteer is not in the meeting.
Send in WhatsApp. Your answer, you can send in it WhatsApp group that is created for you. Times of. So the answer is Melas syndrome, that is mitochondrial encephalopathy, lactic acidosis, and stroke-like episodes. So the symptoms already given, the encephalopathy symptoms, speech apraxia or dyspraxia, and difficulty in conveying the dysphagia is also there, ataxic gait, and there is weakness in the muscle weakness is there, that is for myopathy. The first picture shows that is the MR spectrometry, that is showing the lactic acid level increased in frontal lobe and in CSF also. And second is the biopsy of muscle that shows ragged red fibers, that you can see the below the membrane of the fibers there is a red color appearance, that is due to accumulation of mitochondria in the below the membrane. And the last is due to mitochondrial inheritance. You can see the disease is going from mother to the children.
Can you please tell the score, because there has been a lot of confusion
That
regarding
we will be telling the score in some time. There is some technical glitch. I'm sorry for that.
Okay.
I just wanted to know when will the answer be considered? Like I was sending in the chat earlier, but then you said to send on the WhatsApp group. So after which clue will they be considering answer?
Team number.
Team C.
Team C. 30 points. You send the answer after which clue?
After clue 3.
Clue 3. Your response has been recorded accordingly.
Okay.
Since you are facing some technical difficulties, we request all the teams to send your answers to the WhatsApp group that is assigned to you. Is that clear to everybody now? Hello?
Yes.
Yeah.
Can you please tell the same for team F? Like, when was our response considered? Because there was a lot of confusion.
Team F send the score after the fourth clue.
We send a response after the third clue.
We sent it after the
Third clue. On the chat as well as on WhatsApp.
You can check right now.
The volunteer was not there on the chat, and that is why we sent it on the WhatsApp group after the third clue, not the fourth one.
You can also check the time when it was received.
Okay, you get 20 points, Team F. From the next
according
question,
to the third clue, right?
Could you just?
Yes.
Could you just tell the score for all the teams?
Tell for this question. No, only for this question. Tell for this question.
Team A 20, Team B 20. Team C 20, team low, sorry, and team F is 20. Everyone is getting 20 except team E, that is 0.
Is it clear?
Team E 40.
For this,
Team E 0.
I hope that's okay with everybody. We'll move on to the next question. Please send your answers to the WhatsApp group.
Everyone clear with the question and explanation? So I'm moving to the next question. I'm reading out the question. A 44-year-old diabetic woman with history of partial seizure developed acute hyponatremia and 2 subsequent 20-clonic seizure after ingesting twice her evening dose of drug X. On admission, her serum sodium level was 118 milliequivalent per liter. An infusion of sodium chloride 0.9% was begun, and within 24 hours, the serum sodium level had returned to her previous level of 136 milliequivalent per liter. The woman had experienced a similar event 6 months earlier when she also took a large dose of drug X to relieve the chronic pain of diabetic neuropathy. What is the drug X here? Your time starts now. Thirty seconds remaining. So time's up for the first clue. I'm showing the second clue. Thirty seconds remaining. Ten seconds remaining. Time's up for this. I think everyone has answered the question correctly after the second clue. So I'm showing the next clues, and the answer is carbamazepine. So after the high dose drug injection, there is a decrease in sodium level, hyponatremia. That is a adverse effect of the carbamazepine drug, that because that causes SIADH, that decreases the sodium level. And the first picture that is showing the Steven-Johnson syndrome. And second and third clue is aplastic anemia, that is also an adverse effect of carbamazepine. And the second clue shows the induction. Carbamazepine drug induces the enzyme that itself metabolizes the drug, so the curve is like this. So everyone has answered the question correctly. I'm going for the next question.
Scores of each team? What?
Yeah, scores, please tell now the clue.
We'll tell after the completion of the round.
Then it becomes difficult to track.
Okay?
No,
Yeah,
no,
exactly. Can you?
we actually want to know like which team answered after the first two, which team answered after the second.
Okay. So team A getting 30 points. They have answered after the second clue. Team B 40 points. Team C 40 points. Team D 40 points. Team E 40 points, and Team F 40 points. Except Team A, who is getting 30 points. All are getting 40 points. Is it clear? So I'm going for the next question. A 30-year-old fisherman from Japan presents with complaint of productive cough and tenacious rusty sputum with fishy odor and hemoptysis. On further questioning, he gave history of fever, dyspnea, chest pain, malaise, and sweats from past 6 months. The patient gives previous history of abdominal pain, diarrhea, urticaria 6 months back. He also gave history of consuming raw food. Chest X-ray was taken and it shows multiple cyst and nodular opacities. Peripheral smear shows eosinophilia. What is the most likely cause of this condition? Your time starts now. Thirty seconds remaining for this question. Seconds remaining. Time's up for the first clue. I'm showing the second clue. Thirty seconds remaining. Time's up for the second clue. Seconds for the third clue. I think everyone has said the answer correctly after the third clue, so we can directly go to the answer. The answer is Paragonimus westermanni. I think everyone is clear with the question, so no need of explanation. Okay, I'm explaining the question. It is the Paragonimus. Yes. Anyone telling anything? Okay, the disease is 4. Okay, after the question 4, in question 4 round, team A getting 40 marks, team B 40 points, team C 40 points, team D 40 points, team E 30 points, team F 20 points. So the disease is more prevalent in Japan. That is given in the history and causes as it is a chronic disease. Hello, yes.
You have sent it on the first clue only. I have made it clear on the WhatsApp group also. When you said 10 seconds, I have sent it.
It didn't come within the time limit, so we can't.
But we sent it before the second clue was displayed.
Yeah.
See, all our volunteers are working properly actually. I think some net issue is there with you. Can't help with that.
A similar problem, but you consider that. Why not for us?
Sorry, I couldn't hear you.
Team F also had a similar problem in the round, in this round only, but that time it was considered. So I guess you can give us the.
That was the part
before the picture was shown.
question that we shifted to the WhatsApp group, and so after that, I think now it's okay. No problem with this. Everything came within time, so we're not changing anything for this question. I think we can move on to the next question. So I'm reading out the question. A person suffering from acquired immunodeficiency syndrome, AIDS, presents with complaint of headache, vomiting, fever, neck pain, and altered mental status. He gives a history of visiting a bad century. Gram stain of CSF shows the following, that is given in the picture. What is the causative organism here? Thirty seconds remaining. Fifteen seconds remaining. I think all have answered correctly with the first clue only. So I'm directly going for the answer. These are the next clues. Answer is cryptococcus. I think no one needs any explanation for this question.
Hi, this is team B. रुक मैं बात करूं.
You can tell.
Yeah. So what happened is I was like telling him to type it out, but there was some like he couldn't hear it properly because I was on my earphone and this was kept a bit far. Then I typed the right answer in the chat like within 2 seconds after he answered it wrongly.
In B, actually, you have answered incorrectly. You are allowed to answer only once. That is already mentioned in the rules. So we can't help you.
We answered, but before he recognized our answer, we changed it because it was a
No. Only once you are allowed to answer. So we can't help you. Except team B, everyone getting 40 points for this question.
Excuse me, did you give them the marks or not?
No, team B no points.
Team B no points.
Okay.
That's what I'm telling
40,
you.
na?
Rest all 40. Okay, I'm telling the points of all the after the 2 rounds of all the groups. Team A getting 170, Team B 140, Team C 180, Team D 180, Team E 150, and Team F 160.
How much for us?
Can you tell your
team B.
B is 140.
Hello.
I'm telling once again.
It is the total
for
for
both
this
the
round.
both the rounds. For both the rounds.
But
no.
Then your totaling is wrong because first round we have got 50. Second
Yeah,
round we have
second
got
round guys.
Round 2. For round 2, I'm telling once again. For round 2, Team A is getting 170, Team B 140, Team C 180, Team D 180, Team E 150, and Team F 160. Is it okay now?
Sorry, yaar, hak diya. But sorry.
We'll give
of 2 rounds.
Okay, I'm telling the cumulative marks of both the rounds. Team A 175, Team B 195, Team C 180, Team D 210, Team E 200, and Team F 160. Everyone clear with this? I think everyone clear. We can go to the next round. Next, handing over to Swiksha.
So here we are with the next round, and that's called the constant variables. So the rules for this round is you'll be allowed to choose a topic of your choice from those displayed on the screen to answer the question from that particular topic based on the sum of marks scored in your previous rounds. That is, the team who has the highest score will be allowed to choose the topic first. You will get 1.5 minutes to answer the question given. 20 points will be awarded for the correct answer, no pass or bounce, minus 10 points for negative marking. I would like to emphasize a point here that there will be bits, that is like 2 or 3 sub questions for one particular question. For the positive marking, the differential marks are mentioned along with the question. But when it comes to the negative marking, even if you answer one single bit wrong, you will get a minus 10. Please keep that in mind and answer accordingly. Is that clear to everybody? Does anyone have any doubt?
Yeah, just a doubt. If we answer 2 sub questions correctly and third question we don't answer or say pass, do we get negative or the positive of the 2 sub parts?
If you answer wrong, you will get negative. If you don't answer, you don't get any mark. And you will get the differential score for the A and B.
Okay.
I have a question.
Yes.
Like you are saying that you have subsections in the question. So like if we are not able to answer like either, so that will also be like negative, right? If we leave that question like subsection to be negative marks milenge na?
No. If you leave a question, it's not a negative. If you tell the wrong answer, it's a negative. Like for example, if there are 3 parts, that is A, B, and C for a question. You know the answer for A and B, but you tell the wrong answer for C, you get a minus 10 and according differential positive marks for A and B. And at the same time, in case you do not tell the answer for C and you tell the answer for A and B, you get the positive marks for A and B, but 0 for C. Only when you tell a wrong answer, there is negative marking.
No, we get minus 10 whole or we get the 2
minus
positive
10
and
for
then
C.
minus 10.
Yes. Minus 10 will be like if in case the differential has like A has 10 points, B has 5 and C has 5, you get 15 points for A and B and a minus. Like if you have any doubt, please let us know, we'll explain.
Okay, one quick doubt. There are 3 subparts. If we answer 2 incorrectly, for minus 20 we'll get. Okay, is that true?
Yes. 1 answer wrong, minus 10. 2 answers wrong, minus 20.
Okay.
Is that clear now to everybody? So I guess the funda for this round is don't tell the wrong answer. You either tell it right or don't tell. Is that clear to everybody now? I think we can go on with the round. Over to Debashish.
Hello everyone. So the rules are pretty clear about this round. So please note it has negative markings, 10 points. So as team D is getting the most marks for both the rounds, 210 points. So it will get the chance to choose the subject. Which subject you want to choose, team A? Team D, sorry. Hello? Team
Did
D?
you follow? Did you? Okay.
Yes.
Team D, Delhi.
We will choose the Viru from Uganda.
Okay. We'll go to the question. So it's from microbiology. So I'll read the question. So X virus infection is rare in India and was reported first in 2017, 3 cases in Gujarat and 1 in Tamil Nadu, followed by an outbreak of 157 RT-PCR confirmed cases in Rajasthan in 2018. To date, no case of congenital infection has been reported in infected pregnant women in India. The government of India maintains a laboratory-based X virus surveillance involving viral research and diagnostic laboratories. X is a virus transmitted by the bite of the mosquito. Y and Z are the reservoirs for these viruses. It was named after its place of discovery, a forest in Uganda. It has the potential to cause Guillain-Barré syndrome in case of infection during pregnancy. Apart from the bite of Y, it is also transmitted by other modes, mother-to-child transmission, rarely through sexual contact, blood transfusion, and organ transplantation. X virus belongs to the family P. You have to identify X, Y, Z, and P. Your 1.5 minutes starts now. One minute remaining.
Hello.
Can we answer?
Can we answer?
Yeah, you can answer.
Okay.
Sorry, Team D.
We answered. Did you hear us? Did you hear
Hello.
us?
Am I audible?
Team D answered.
We answered
Hello.
the question now.
X I heard. Y I
You are
heard.
saying it is
Z.
Aedes, mosquito, Zika virus, flaviviridis.
Z.
Families.
Okay.
We are.
We don't know about the
One
Z.
more.
We don't know.
We are leaving Z.
We are leaving it.
Okay. So you are in total. You are getting 15 points. The answer is all these you said. The Z is monkeys. Then we move to the subject slide. So now the next team is Team E, getting 200 points. So which subject you want to choose? Team E.
Foes of the Jews.
Okay. So this is a question from pathology. A mutation in gene X is responsible for causing familial cancers in organs Y and Z. The mutation is inherited in an autosomal dominant fashion. In Ashkenazi's view, population in 1 in 40 individuals carry mutation in the gene X. In 2013 and 2015, a famous Hollywood actress underwent a prophylactic surgery for the removal of Y and Z respectively because of positive family history for cancer on her maternal side. Drugs which inhibit poly-ADP ribose polymerase are used for the chemotherapy in the cancers involving Y having mutations in X. You have to identify X, Y, and Z. Your 1.5 minutes starts now. Yes, you have to tell X, Y, and Z respectively, clearly. One minute remaining.
Hello.
Hello. Hello, can we answer?
Yes, you can answer. Yes, you can answer.
So X is
BRCA,
BRCA1.
BRCA. X is BRCA.
Okay, next.
Y is hello.
Y is breast.
Hello, yes,
And
you are audible.
Y is over breast and Z is ovaries.
Okay. So your answers are correct. You get 20 points for this question. So these are the questions, answers, and then we move to the subject slide. So next, team B will get the chance to choose. So which subject you want to choose, team B? Hello?
Bloody surgeon.
Bloody surgeon. Okay.
Yes.
So this is a question from anatomy. So figure 1 shows X, a rare non-atherosclerotic cause of lower extremity arterial insufficiency. The anatomical site Y is named after a famous British surgeon who for the first time performed surgery for the condition Z that is shown in figure 2. Neurolysis and block of P is also done at Y. You have to identify X, Y, Z and P. Your 1.5 minutes starts now. Forty seconds remaining. Fifteen seconds.
You'll pass.
You'll pass. Okay.
Yeah, we'll
it's okay. So you get 0 for this question. Okay. Next, so answer is this: X was adductor canal compression syndrome. Y is named Hunter's canal. Z is in figure 2. It was popliteal artery aneurysm. P, the nerve is saphenous nerve. So the next team will be team C. Which subject you want to choose, team C?
We'll go with vortex.
Okay. So this question is from pharmacology. So X is a drug developed by Vertex Pharmaceuticals and is the first medication that treats the underlying cause rather than the symptoms of the disease Y. Y is an autosomal recessive disease caused by defects in Z protein that regulates within cells and affects the components of sweat, digestive fluids, and mucus. The most common mutation is a deletion mutation that loss of the amino acid phenylalanine at the 508th position of the protein Z. X is a potentiator of Z. You have to identify X, Y, and Z. Your 1.5 minutes starts now. Forty seconds remaining.
You can answer, right?
Yes, you can answer.
So Y is disease is cystic fibrosis. Z protein is CFTR.
Okay.
And the drug X potentiator is ivacaftor.
Okay. So this question is correct. Answers are correct. So we'll move to the answer slide. So this X is ivacaftor, Y is cystic fibrosis, and Z is CFTR. We'll move to the subject slide again. The next team is Team A. So which subject you want to choose, Team A?
Feel the rhythm. Feel the.
Okay. So this is a question from physiology. So X is a cluster of interneurons in the ventral respiratory group of medulla of the brainstem and lies on either side of the medulla between nucleus ambiguous and lateral reticular nucleus. In 1991, X was described as a region to generate respiratory rhythm in neonatal rat brainstem preparations. X is named after a variety of wine which was served at the conference at which the region was named. Unilateral ablation of X in the brainstem disrupts breathing during sleep. These neurons basically contain two types of receptors, that is Y and Z. Depression of respiration is a predominant side effect of the drug, which is given for analgesia through their action via Y receptors. Z type of receptors interact with G alpha Q protein and induces activation of phospholipase C, leading to production of IP3 and elevation of intracellular calcium. You have to identify X, Y, and Z. Your 1.5 minutes starts now.
X is pre-Botzinger complex, Y is mu opioid receptor, and Z is serotonin receptor, 5-HT.
Z again, can you repeat?
Serotonin.
So the X and Y are correct.
5-HT receptor, na?
X and Y are correct, but Z. Tell once again X, Y, and Z. Hello.
X is pre-Botzinger. Hello.
Okay. Hello. Yes. Audible.
Mu opioid नहीं, उसका mu opioid है ना? Z का
Y is
wrong.
Z. You told serotonin, right? Z.
Yes.
Yes, you told. So X is correct, Y is correct, Z is neurokinin 1 receptors. So for that question, for that option, you get -10. So your total will be +5. So we move again to the subject slide. So the team F, which subject you want to choose?
Dissection dealer.
Okay. So this is from forensic medicine. So X and Y in the years 1927 and 1928 killed 16 persons in Edinburgh and sold their bodies to Z for use as specimens in his anatomy classes. A victim, usually alone or away from the family, was invited to their house and given alcohol. Then the victim was thrown to the ground, and X used to kneel or sit on the chest and close the nose and mouth with his hands, and Y used to pull him round the room by the feet. So you have to identify X, Y, and Z first. Then what is the name given to this type of homicide? And then third question, who among them turned approver? Your 1.5 minutes start now. Forty seconds remaining.
Okay, we'd like to answer. The second
Okay.
question is Burking,
Okay.
and
X is
Roman Burke.
Again, can you answer?
Second question. The answer to the second question is Burking, and
Yes. Next.
and
For
for
X is Burke.
Okay.
and just a second.
Anything else?
Z. Z is William Herschel.
Your time is over. So
Z is William Herschel. We did answer, right?
no, Z is wrong. X you told Burke. And second option, second question you
Burking.
told Burking. So you get. Yes. So Z you told wrong. 7 you got for the correct answer and -10. So -3 will be allotted to you. So last question is last subject is remaining, that is ridiculous Romans. It's an audience question. No marks are allotted for this question. Anyone can answer. X is a disorder which caused bizarre behaviors in some of the well-known Roman emperors, including the last of them. It is a disorder which can be transmitted from unaffected parents, and some of the generations can be skipped with no gender restrictions. It caused due to defect in transport mechanisms across both intestine and renal tubules. It can cause skin manifestations, diarrhea, memory loss, and even difficulty in maintaining balance. Young children are often clinically normal. A special test can be used to detect the derivatives which are increasingly excreted due to defective transport of the compound. The test Y is as shown below. Z can be useful to treat X. So you have to identify X, Y, and Z. Anyone can answer.
Hartnups.
Okay, yes. And what is the test?
Obermeyer test.
Okay, it's correct. So
Vitamin C देते ना.
This one. So this round is over, and the cumulative marks for each team is: Team A gets 180 point, B is 195, C is 200, D is 225, E is 220, F is 157. I repeat: A is 180, B 195, C 200, D 225, E 220, F 157. So next, over to Sudiksha.
So at the end of 3 rounds, and it's called the time bomb. So here are the rules for the round. There will be a total of 10 questions that will be displayed on your screen, and each question is worth 3 points. You will be given a duration of 1 minute to answer the questions in the set. One teammate may speak out the answer. The other teammate may suggest answers in the chat box. Here, please ensure that you change the settings in your Zoom meeting to send message to everybody, and there will be no negative marking in this round. One important instruction: please change your settings in your Zoom meeting to send message to everyone. In case you are send a thumbs up so that we can make sure that you have changed the settings.
This is the last round?
Yes, this is the last round.
This is for everyone, open to everyone.
No, it's directed to one team, right? So you can
chat box.
Why will we need a chat box? Like we are discussing over call.
What is the
okay, then only one teammate may speak the answer.
Yeah, no problem.
Okay, then only one teammate may speak out the answer. Is that okay with everybody?
Yeah, it's okay, but we don't need to answer on the chat box, right?
In case
No. We thought maybe if we give this option, it will be easier for both of you. Like one of you can, while one of you is answering the first question, the other can type the answer in the chat box for the last question. But if that's not coordinating with the both of you, I guess we can go with only one teammate speaking out the answer.
Excuse me. If both of us are sitting together, then we can designate one member to answer. The other can talk while we are discussing, right?
Yeah. But please make sure you answer the question only once. Please don't change the answers after you have told one answer. Okay. And in this round, the questions will be displayed, and once the questions are displayed, your time will start. Nobody will be reading out the questions for you. You have to read it by yourself and answer.
Excuse me.
Yes.
The questions, we can answer it in any sequence, or is it necessary to go in the order in which it is displayed?
It can be answered in any sequence. Mention the question number clearly and then tell your answer if you are going in any pattern.
Okay, thank you.
Please make sure to mention the question number clearly and then your answer, in case you're not going in order. I guess I'm clear to everybody. Only one answer will be considered. There is no negative marking in this round, so you can attempt the questions. The questions will not be read out by a quiz master. You will have to read it on your own and answer. Once the slide is displayed, your time of 1 minute will start. And make sure that only one final answer comes out for one question. Please don't keep changing the answers. There's no negative marking.
Okay, I have one So like we could like keep our mic open. We can discuss among ourselves and like we can blurt like this is answer for question number 1 is this. Like we can say like this also, no? This will work, right?
Yes. That you can do.
So that
see, any discussion will not be considered for your marking. Only the final answer that you utter will be considered.
Okay.
Is it clear? Is it clear to everybody? Total duration for 10 questions is 1 minute. You have to answer the questions within that 1 minute time frame. Are we clear? Are we good to go? Okay, if there are no other queries, I think we can move on to the round. Over to Riaz.
Good evening, everyone. My name is Riaz. I will be the host for this round. Subiksha explained you the rules for everyone. So we will proceed with similar to the last round. Here, the team with the highest score will select one set from this. So team D has 225 points. You can select one set among these 6. Team D, which one you want to take?
We will like to select the 4th form.
Okay. I will just display the questions, and when I display the questions, the timer will start, and you can just mention the question number and tell the answer. I won't say whether it is right or wrong. After the finish of 1 minute, then I will tell you how many answers you have said correct. Is it clear?
Okay. Are we audible?
Yeah, you are audible.
Okay.
Okay. Your 1 minute starts now.
Quinard segment.
First is Quinard. Second is the 5th layer of primary cortex.
Third is
Hawkinsonuria.
Next.
Fifth is desmopressin.
Okay.
Palcum agar is for list 6 palcum.
7th is listeria.
Okay.
Transitional बोलते ना transitional stratify तो नहीं होती stratify transition.
9th is transitional epithelium.
Mutation is chromosome 19 and STK11.
10th is STK11 gene.
Chromosome 19 on chromosome 19 the STK11 gene. And which questions are left? Question number, can you just pick to bronze
question number 4, 6 and 8.
Question number 6 answer should be nitrates. We are going for nitrates and so sorry.
Okay, your time is up. Your time is up. You have answered 6 questions correctly. I will display the answers for you. So the first question, segmental anatomy is named after Claude Quinard. You answered it correctly. Second question, layer 5 of primary cortex contains bed cells. You have answered correctly. Question number 3, swimming pool order. It is found in Hawkinsonuria. You have answered correctly. Question 4, William C. Campbell discovered antiparasitic effect of ivermectin. You didn't attempt this question. Question 5, desmopressin. You have answered correctly. Question 6, bronze color PM staining seen in Clostridium perfringens. You answered it wrong. Question 7, Palcum agar listeria. You have answered correctly. Question 8, definitive host of schistosoma is human. You didn't attempt this question. Question number 9, stratified columnar epithelium, you said transitional, so it is wrong. Question number 10, you answered correctly. So you have answered total 6 questions. You will get 18 points. Okay. Good job. We'll next team E has 220 points. Which set you want to select? Team E. Okay. Now I am going to display the questions. Your time starts now.
One is pterygopalatine ganglion.
Okay.
करता हूँ मैं यार, तू आगे.
HGPRTS 3, Artemisinin.
Fifth is magnesium.
Fifth is magnesium. Regan-Lowy agar 7 is for bordered uses. Trine tube. Ninth is ciliated columnar epithelium. 10 leaf romani is P53.
Okay.
Which are remaining?
2, 4, and 5, 6, 8.
2, 4, 6, and 8.
8
10
is
seconds remaining.
8 is human. And 2 is
2, 4, 6.
Monroe
Okay,
Kelly doctrine. Second Monroe Kelly doctrine.
We will consider the second one. So you have answered 8 questions correct. You will get 24 points for this round. So you have left the 4th question and 6th question. The 4th question is artemisinin was discovered by UU2, and the 6th question, Mini-Packer syndrome is associated with cocaine abuse. Remaining questions you have answered, so no need to discuss, I think. So we will proceed with the next team. Next team is Team C with 200 points. Which set you want to select, Team C?
Time bomb number 4.
4 is already over. 4 and 2 are over.
1.
Questions are not displayed.
So thoracodorsal is C6, C7, C8.
Okay.
Hurler deficiency is L-iduronidase. 4th is COX.
Okay.
5th is adenosine. 7th is Vibrio parahemolyticus. 8th is CAT. 9th is simple cuboidal. 10th is P10 gene.
The second and 6th question are remaining.
Second is J receptor. And 6th is
Okay, time is up.
अरे यार बोलना.
Time is up. What did you say for second one?
Second is J receptor.
Okay. Okay, you have said 7 questions right. You will get 21 points. So, question number 5. You said drug is adenosine. It is adrenaline.
Adenosine, na PSVT.
Adenosine is the.
We don't give adrenaline in PSVT. Patient will go into shock.
Yeah, just confirm. PSVT is adenosine.
Okay. Yeah. Give us 1 second. We will confirm. Okay. Question number 6. Question number 6 you didn't attempt. Facial pallor is the earliest sign of lumpism. Question number 9. You said simple cuboidal epithelium. It is simple squamous. So okay, we have confirmed adenosine is the right answer. So sorry for the inconvenience. You have answered 8 questions correctly and you will get 24 points. Now we will continue with the next team. Next team is Team B with 195 points.
AIIMS bomb 5.
Okay, we will display the questions now. Your time starts now.
Second is suprachiasmatic. Third is tryptophan. Hopkins. Third is tyrosine. Fourth is acid. Fourth, zeal. We'll see. Fourth is zeal. Fifth is sildenafil. Sixth is cyanide. Seventh is Corynebacterium diphtheriae. Ninth is transitional. 10 is VLH. VHL. Von Hippel-Lindau syndrome.
Okay, question 8 and 1 you didn't attempt. Okay, time is up.
L1.
No, time is up. You have answered 5 questions correctly. First question you didn't attempt. Esophagus enters the stomach at T11 level. Question number 3, you said tyrosine. It is tryptophan. Question number 4, it was Paul Ehrlich who reported the acid fast nature, not Gill. And question number 8, snail is the first intermediate host of clonarchis. You didn't attempt this question. Question number 10, mutation in MET gene. So you have answered 5 questions. You will get 15 points for this round.
Hello.
Okay, now team A.
Which one is left?
You can set 3 and set 6.
Set 3, okay, 3.
Okay, you want 3?
Three. We'll go 3.
Hello, team A.
Yes, 3.
Team A, can you check your internet connection? Okay.
Hello.
Okay, I'm going to play the questions now. Your time starts now. Yeah, you're audible. You can start answering. Time is running.
2 is eye cells. Fabry अपना ये ना alpha galactosidase. Clean glycol में ethylene fomepizole. First intermediate host 6 is अरे नहीं रे 8th is क्या होते हैं cyclops वगैरह ना cyclops. 9th is stratified squamous. FAP is a
10 seconds remain.
हाँ
10 seconds left.
APC कौन सा बचा है भाई?
Okay, time is up.
Mary Jane कोई ड्रग था ना, कोकेन या कुछ?
Time is up. You have answered 5 questions correctly. First question, the segment 4 portal vein branches originate from the left portal vein. You didn't attempt this question. Question number 2, it is S cells. You answered it incorrect. Question number 4, Sir Ronald Ross described life cycle of malaria parasite. You didn't attempt this question. Question number 6, Mary Jane is a common name of cannabis. Question number 7, BSK medium is used for culture of Borrelia burgdorferi. Remaining questions you have answered. So you will get 15 points. Now team F, are you ready?
Yes.
We will have only set 6 remaining now.
Okay. Yes.
Okay. Now I am going to display the question. Your time starts now.
Keep talking, guys. In NREM says 3 and 4. Salkovsky.
Mentu syndrome is.
Mentu syndrome is associated with the red gene. In the sweat glands, there is Simple cuboidal epithelium. Invertebrate host of trypanosoma is Satsefly. Fildes agar is...
Transposons is by the scientist Barbara. And fifth is N-acetylcysteine is a drug of choice for paracetamol poisoning.
Olive green urine is phenol poisoning.
Okay.
Fildes agar is in
Hemophilus influenza. Invertebrate trypanosoma.
बोल दे Satsefly.
तूने बोल दिया ना Satsefly.
Alternate.
Eighth is Satsefly, we already said.
First, we would like to guess popliteal ligament. Tchaikovsky test.
Okay. Time is up.
Tyrosin. Tyrosin.
We are guessing tyrosin.
No, time is up.
Okay.
Okay, you have answered 6 questions correctly. Okay, you have answered 7 questions correctly.
Okay.
You will get 21 points. First question, Arantius ligament is ligamentum venosum. Question
What
number
are the
3,
questions you've considered incorrect?
First, the questions which I am telling now. First question, Arantius ligament, it is ligamentum venosum. Question number 3, Salkowski's fish, it is used for cholesterol.
Okay.
And question number 9, it is stratified columnar epithelium is seen in lining the sweat gland. These 3 you have answered incorrect.
Okay.
Okay, we'll come back to you with cumulative scores now.
We have one extra question. We can see that question. It's a picture question, and you can guess what it would be. No points for anybody. It's just
Kawasaki.
Yes. Okay. That's all. So here we are with the scores. The final scores. Team F has got a score of 178. Team A has got a score of 195. And then we have Team B with a score of 210. And then Team C with a score of 224. And this time, Panacea, the top 2 teams, there's only a difference of 1 point. And the winners are Team E with a score of 244 and the runners-up are Team D with a score of 243. Congratulations, the winners, Team E and Team D. Good job. Just by 1 point. I hope that was very good. So yeah, that's the end of it. Thank you all for participating in Panacea. We hope you had a good time. If there are any suggestions that you would like to give, you can give now so that we'll improve the next time.
Can you please put the PPT on the group? The questions which you had in the quiz, no?
Okay, yeah, sure. Hope you all enjoyed quizzing with Panacea 2.0. Okay. Any suggestions? Please feel free. And we thank you all for your cooperation and coordination among yourself for the smooth organization of the event. Though it was an online event, I think we could pull it off pretty well with some internet issues in between. But I guess that's okay. So yeah, thank you all.
Thank you.
Thank you.
Once again, congratulations to Team E and Team D. And congratulations to all the finalists for reaching till here. Thank you all.